Let's talk lips. Lips are probably the single most popular area injected in our practice, and patients often come in with their wish pictures and kind of a feeling of what they want, but they really often don't have the vocabulary about how to ask for what they want. So let's talk about the vocabulary of lip injections and also give you some of the different things that you may wish to see or may wish not to see. I want to know that the pictures that I'm going to show you here are all just taken off Instagram. Actually, I asked my viewers to send in photos that they liked and photos that they didn't like, and so none of these are meant to take pot shots at any account. Everyone's got their own personal style and taste, but I want to give you the vocabulary to empower you to go to your injector and describe exactly what you want, in addition to being able to bring your own wish pictures. So with that, let's get started with some lip anatomy terms. So first, these are the general terms that we use when we're describing lip anatomy. The edge where the color of the mucosa, which is the wet or the lip kind of pink stuff, ends, we call that the vermilion border. And that just is exactly what it says. It's the red line, the vermilion border. The three-dimensionality, where there's a little drop-off there, we call that the white roll. And obviously it's not white in every lip, certainly not in mine, but that's just what it's called. We used to then call this the white lip and the red lip. Now we are more specific, and this is the red lip, and this is considered the ergotrid. That's the actual anatomical term for what used to be called the white lip most of the time. Filtral columns, these are the little ridges that are right here and right here. They're typically more prominent in youth, just like the white roll is typically more prominent in youth. And as we get older, those little details tend to blur out. Between the two is what we call the filtral dimple. And it's kind of defined by the presence of these filtral columns and what we call the Cupid's bow, which is a section of the white roll. The native lip is subtly convex in most people, and it's convex in 3 areas or tubercles on the top lip and 2 tubercles on the bottom lip. And so when we are trying to maintain a natural shape, we typically try to keep that in mind. The mucosa, the red stuff here, has 2 different types. There's the dry mucosa, and then there's a spot where it goes to what's called the wet dry line, to the mucosa that wraps around behind the lip, and that's the wet mucosa. So we call that the wet dry border. I disagree with the placement of this dot here. It's actually more where that line is. So those are general terms. Another term that's good to know is the oral commissure, or the angle, or the outside edge. A lot of times people's lips will stop a little bit short here, and they want to see this part of the red lip come all the way out to the oral commissure. That may not be a natural look, but it's very trendy right now, and that's the word you want to use. So white roll, very common area, talk about. Cupid's bow, very common area to talk about. Filtral columns, filtral dimple, filtral columns. Tubercles, wet dry border. Those are kind of the biggest terms. So that's our review. With that then, let's talk about ratios. So the natural upper-lower lip ratio varies, but in basically everybody, the lower lip is heavier or more full than the upper lip. It's usually upper lip 1, lower lip 1.5, or upper lip 1, lower lip 2. It's usually lower lip dominant. When you start getting into some of these categories where they're almost balanced, or where the upper lip is actually slightly fuller than the lower lip, that is by definition an unnatural look, but that doesn't mean a bad look. Again, everyone's got their own tastes, and if that's what you want and that's what makes you happy and that makes you feel pretty, absolutely go for it. But if you're looking for what's most likely to be natural, this is about as full as you want to see an upper lip in relation to a lower lip, proportions wise. That we have some control over. The width of the mouth, the distance between the oral commissures, we really don't have any control over. That you can't change that with lip injections. So for instance, you might like this heavy lower lip picture and this heart-shaped picture and say, I like this, can you stretch my lip out so I have more of this shape? And the answer is no, we really can't. All we can do is change the fullness in the vertical dimension. We can't change the aperture in the horizontal dimension. So lips, until about 2 years ago, augmented lips typically took on a shape that looked a little like this, which was very pillowy. And pillowy is a term that we use a lot. And what this looks like is it's strongly convex, very full. and all the little wrinkles are hydrated out, and it just kind of looks full or pillowy or hydrated or saturated. Some people will say these look inflated. As a matter of fact, with time, sometimes a lip that is this full, and with certain products that are more hydrophilic, they can migrate out onto the top surface of the lip. And that's not necessarily the injector's fault or the product's fault. Sometimes this is just such a mobile area. Once you've had lip filler for 1, 2, 5, 10 years, it would be a miracle if it didn't travel somewhere. So that is something to keep in mind. This filler can sometimes, after a long time, end up where you didn't intend for it to be. And we're going to talk about correcting that here in just a minute. But this was the most common lip style up to about 2 years ago. Over the last couple of years, we've seen an increase in what they call lip tinting. Some people call this the picket fence technique. Julie Horn calls it that. Some people call it the Russian lip technique. And what's different about this technique is the filler is placed, first off, it's usually a more structural filler, and it's placed in vertical columns like this. And these vertical columns add stiffness to the lip in this vertical dimension, which literally pushes the lip upward and outward, and we call everts the lip. So in this tinting technique or Russian lip technique, what we gain, which we didn't gain from previous techniques, is the vertical height of the lip, and that visually shortens the white lip or the ergotrid. So it changes the ratio between the white lip and the red lip. So it can change that ratio pretty dramatically. One of the things that and the follower that sent this one to me said she felt like it looked a little aggressive or a little unnatural. And again, this is personal preference on her part. One of the things that can be a little unusual with this is that fullness, the convexity on the front is often lost because the filler is really put in such a vertical direction, and it's a more structural filler that doesn't hydrate quite as well. The lip can look kind of flat. And while that looks good on front view, and again, looks good on front view, sometimes when you see these people in real life on side view, on 3/4 view, you start noticing things like a heavy, heavy shadow just over the white roll, and it almost starts to look mustachy. And this is an immediately fresh injection, obviously. This is probably going to settle down, and again, I'm not taking shots at anything, because I have my own results that I don't totally love every time. But this real heavy Russian lip edge, I think, can make this shadow sometimes distracting and sometimes a little unnatural. And when you turn your head, it can look a little strange. When you speak, it can look a little strange. So, everything is good in moderation. I actually really like the Russian lip technique or the tinting technique in moderation to help create some structure. But sometimes, maybe if you take it a little stylized, make sure you know what you're asking for when you do that. You have probably heard that to get the Russian lip technique, if you've had previous filler, that it needs to be reversed. It's true and it's not true. So if your previous filler has migrated all the way up into your white upper lip and just obliterated the white upper lip and flown all the way into here, then it absolutely needs to be reversed. And so you can see in this injector's job here, she has reversed all of this, and then you have to wait a little while, week or two at least, and then refilled in a little more structured fashion the lip. And I think it's a nice transformation. It's a nice improvement. This one is more subtle. So this patient, I think her lips are overall very nice. My personal preference would be to have a lower ratio with a little less upper lip compared to lower lip. The one place that the patient, in my experience, would likely come back and complain to my injectors about would be right here. There's a little bit of fullness in the white upper lip, and it makes the white roll go from crisp to blurred right there. But if you look back at her before pictures, that was pre-existing. She had a little excess fullness right there, and then by tinting this lip up, the filler makes the lip fold a little high up, and that little bulge is there. So this is an example of, you can't get this lip perfect unless you give the injector an opportunity to dissolve at least some of the old filler, which requires patience. If you've flown in to see an injector, or if you drive many miles to see an injector and you don't want to make another trip a few weeks from now, or you don't want to pay for the reversal of filler. Most injectors will reverse their own filler if you don't like it. But if someone else injected your lips and you come to see an injector and ask them to start from scratch or to fix something else, they're going to pass on the cost of that reversal agent to you. So if you want to try to get away without reversing your existing filler, bear in mind that may influence the final quality of your final result. And your injector will talk you through that as to whether you have to reverse it or whether it would be just the best practice to reverse it. So this is actually one of our injectors, Jennifer Jones. She does beautiful lips. You can follow her on Instagram. These lips are what I consider stylized. So they are, I think they're super pretty. Absolutely gorgeous. A lot of people use the term keyhole for this. She's got a beautiful keyhole right here. She's got appropriate definition of the white roll, appropriate tubercles, appropriate hydration. But I would consider this a fake natural result. So it's super pretty, it's super tasteful, but if you want lips like these, you have to be ready for certain people that are really perceptive to ask you where you got your lips done. And Jennifer would love, and I would love if you told them Jennifer Jones. I think these are super pretty. But these, in my opinion, don't pass for completely perfectly natural. And so you have to kind of set your level of, you know, it's like when, if I were to get blue contacts and blonde highlights, you know, that might be something that I feel like looks really good on me, but I'd have to know that people are going to think that I had that done, and then that's totally okay. So you have to know if you want to look super natural, or again, this is model pretty, but maybe you're going to get a question or two. On the other hand, there's some lips that I think everyone is going to know that you had done, and again, I'm not taking shots at anybody's results or patients or tastes. But to me, I think these lips, every single person that you see is going to ask you about your lips. And the ones that don't may be talking about your lips without your knowledge. And so it really, again, it comes down to what you want to do. If you were to ask me or most of my injectors, pretty much all of my injectors, to do this for you, you're probably going to get a no. And so that's something else you need to know. Not every injector likes to do every style of lips. I like to say it's like a pink mohawk. You know, some people look great in a pink mohawk, and that's how they want to look, and they go into their hair salon and ask for a pink mohawk. Well, if I'm a very conservative hairdresser and I don't want to be known as the pink mohawk guy, I'm not going to do a pink mohawk here and there because it's going to decrease my other customers' opinion of my tastes. Meanwhile, right down the street, there's the pink mohawk salon where they are known for the quality of their pink mohawk. So best thing about Instagram these days is you can find an injector whose aesthetic matches your desires. And so it's better to go to one where you see the results that are what you want to have, rather than go to one that just happens to be close to you, has a good reputation, and try to ask them to do something out of their comfort level and out of their personal tastes. So with that, I want to show you something that I think is important, and that is some moving video. So we talked about the Russian lip can look pretty on front view, but can look weird on side view. I think it's important to actually see all the different angles. So this is actually another one of Jennifer Jones's lips. I think this is really natural, super pretty. And what makes it natural and pretty is the ratios are really nice. The accentuation of the white edge, white roll here is not over the top. And there's even a little bit of texture left in the lip. Not as much as before, but a little bit of texture. And I think that is actually really pretty. So I think we should be looking more and more at multiple angles, and ideally even at moving video when we're assessing what we like and don't like about lips. So moving on, Photoshop. So I can't tell you for sure that these lips are Photoshopped, but I think they probably are. And what are my clues here? I think the big clue is that the lip has been volumized and super volumized down here with no loss of surface texture. I just don't believe that. I think that these lips have at least had some help from Photoshop, because when you really volumize a lip, really hydrate a lip, the surface texture tends to blur out, similar to these lips. So to have this degree of volumization with no loss of surface texture, that's fishy to me. The other thing is to have the additional height built in here, as was done in this case, without flattening the lip on front view or creating any accentuation at all of the white roll. That's also lip fishing.